when we first started to see these atypical cases, again, cases that don't manifest with memory, the first question that comes to mind is how it's possible that we have, what we think is the same pathology, but different manifestation. And the first thing that came to mind is that maybe these cases would have, in addition to the Alzheimer pathology, something else, and this something else will, mask the symptoms and make it show differently. So we went to look into the brains, and we realized that this was not really the case. These atypical cases, actually, they have less of what we call comorbid pathology than even typical cases. Actually, they are even younger, so less chance to have something else. So after we excluded, we started to look the field itself, not only my lab, what could be bringing these differences. And one thing that my lab discovered, and other labs also had similar finding, is that in these atypical cases, the amount of tau inclusions that we have in certain brain areas are much higher than the same amount of tau inclusions in the same brain areas in typical cases. So it points to us that what these cases have is a difference in what we call selective neuronal vulnerability. So the areas in the brain that are more, weak or less resistant to disease, they are a little bit different. And this is what part of what I showed in my presentation, and also some ideas on how we can now leverage this knowledge to the next steps in discovery.